Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. Today I'd like to do a video on Martin Luther King and healthcare and the promise that was made to the people of this country. And his words were very prophetic because at the time that Medicare was passed was 1965. And if you recall around that time, the discrimination that was in this country, segregation, 1964, 1965 were very tumultuous years. I want to share with you his words and start there. Okay. This website is Project Muse. It is a educational website. And this is written by Charlene Garlineau from the Journal of Healthcare for the Poor and Underserved. I went back into the archives to 1966, March 25th, 1966, when Martin Luther King spoke these words in Chicago, and I'm going to show you that. These often invoked words attributed to Reverend Martin Luther King Jr. offer moral sustenance to many persons working towards health equity today. Scholars, practitioners, and activists in healthcare and in public health commonly quote this powerful claim, thus aligning health equity movement with the civil rights movement. In fact, historian John Dittmer opens his account of the early fight for social injustice in healthcare with these words. On March 25th, 1966, in Chicago at a press conference before his speech at the Second Convention of the Medical Committee on Human Rights, King said, in part, "We are concerned about the constant use of federal funds to support this most notorious expression of segregation, of all the forms of inequality. Injustice in health is the most shocking and the most inhuman because it often results in physical death. I see no alternative to direct action and creative nonviolence to raise the conscience of the nation." A short Associated Press news story about the press conference was published in several newspapers in California, Michigan, Illinois, Wisconsin the following day, and is the most reliable account of King's words there. Now, that's absolutely accurate. I have an account with newspapers.com, and I went into the archives at that period, and that's exactly what I found was exactly these words that she types here. This brief passage helps to contextualize King's ideas and signal their implications. This brief passage helps to contextualize King's ideas and signal their implications. Thus, each sentence is deserving of discrete comment given its relevance to the whole. We are concerned about the constant use of federal funds to support this most notorious expression of segregation. His unfailing attention to poverty, racism, and education and housing, what we now often call social determinants of health, make clear his moral concern beyond healthcare alone. Second, King said that injustice in health is inhuman, not inhumane. The distinction here is likely significant as a matter of degree. Inhumane suggests a lack of compassion for human suffering or pain, whereas inhuman is more extreme, suggesting a denial of humanity so egregiously cruel that it is or should be beyond human action. The final difference in King's actual words compared with the more popular version is perhaps the most important, as it reveals King's belief about why health injustice is inhuman. Injustice in health is the most inhuman form of inequality, King says, because it often results in physical death. Now that is powerful. And it explains how he recognized that healthcare at that time was not equal, that segregation and creating waiting rooms and healthcare inequity between people of color or low income. And that is exactly what we're finding throughout today. We have situations, if I want to make a comparison to traditional Medicare and I'll show you the next video, in that you can have Medicare Advantage and your employer or union can force you into Medicare Advantage, but these corporations, because they're greedy for-profit companies, will allow you to see doctors in their network. But if you don't see the doctors in their network and you want to see your doctor and your doctor is not in network, then you will have to pay upfront to see a doctor and hope to get reimbursed. Now, we all know that there's a large difference in salaries still amongst this population of elderly. And that's what we're seeing is when you look at who can have access to healthcare, who could afford to pay. This is where, again, the injustice shows up. And to make that connection, I want to keep showing you over and over that if you're going to honor what Martin Luther King stood for, you don't privatize healthcare. You don't create haves and have-nots. You don't create inequality. You don't create a path to healthcare where people have to pay to access it. That was not why Medicare was created. And let me show you why. This article appeared in US News Today. And it starts off, no civil rights timeline would be complete without the key events of 1965, from the confrontation of the Edmund Pettus Bridge in Selma, Alabama, to the passage of the Voting Rights Act. Medicare appears nowhere on this list for most people, obviously. Yet in its vast scope and the immediacy of its impact, Medicare ranks among the most important civil rights achievements in the U.S. history. And Martin Luther King was right there to make sure that it got passed. By threatening to withhold federal funding from any hospital that practiced racial discrimination as required by Title VI of the Civil Rights Act, passed in 1964, Medicare forced the desegregation of every hospital in America virtually overnight. Amazingly, almost no one noticed. It was kept quite secret, said David Barton Smith, a professor emeritus of healthcare management at Temple University. The White House kept a lid on it. Before the passage of Medicare and Medicaid, Smith said, the healthcare system was tightly segregated. Hospitals in the South complied with Jim Crow laws, excluding blacks from hospitals reserved for whites or providing basement accommodations for them. There was a lot of black communities in the South where they had basically no access to hospitals, said Smith. Most of the black births in Mississippi were at home. The infant and maternal mortality rates were hugely different for blacks and whites because of that. Now, this is another thing that bothers me because you have Speaker Adams and our city council talking about that same disparity in New York City hospitals, and yet they don't recognize that by privatizing a public health benefit that was put in place specifically to stop things like this kind of disparity, that they are now walking us back to 1964. Black patients could sometimes get care at medical schools and teaching hospitals by serving as teaching material, a dehumanizing term used to describe black patients who allowed medical students to hone their skills by treating their illnesses, said Smith, whose book on the impact of Medicare on civil rights, Power to Heal, will be published by Vanderbilt Press next year to commemorate the 50th anniversary of Medicare's implementation. With the passage of Medicare, hospitals quickly integrated 1,000 in less than 4 months, Smith said. Progress was swift because of the way the program was set up. The Johnson administration's Office of Equal Health Opportunity, a tiny office with just 5 employees buried beneath layers of bureaucracy in the Department of Health, Education and Welfare, was charged with certifying hospitals to get federal funding based on whether they discriminated or not. HEW Secretary John Gardner recognized the enormity of the task, decided to call in as much staff as necessary to enforce the law, Smith said. Not wanting to attract attention, he put out a call for volunteers. Quiet call for volunteers. More than 1,000 people from federal agencies offered their help, along with tens of thousands of civil rights organizers. Field inspectors fanned out to hospitals to make sure they were in compliance with the law and eligible for federal funds. They wouldn't let anybody off the hook, Smith says. The reason they were so successful is that they had this secret army of local civil rights workers and local health workers making sure that the hospitals complied. Hospitals quickly figured out they could not fake it. The Johnson administration was determined that the transition would proceed smoothly and was ready to call out the National Guard of the military if any hospital barred their doors to patients or if mobs formed in protest. I went to the White House the week before the program began, and I was told, God damn it, there aren't going to be any screw-ups, Marmer says. There were helicopters, National Guard, God knows what else, all directed towards avoiding any symbolic catastrophe. No catastrophe occurred. Today, Smith said, few recognized how much Medicare and Medicaid have changed their health care. They desegregated the entire system, not just by race, but by income as well, he says. Today, as a consequence, hospitals are the most racially and economically integrated of any private institution in the country. This article was from 2015. Next, I would like to show you a video that talks about the MCHR, the Medical Committee for Human Rights. And this is where Martin Luther King made that speech with that famous quote.
The Medical Committee for Human Rights started up at the beginning of Freedom Summer in June of 1964. In Mississippi, there were probably around 100 altogether, doctors, nurses, and social workers. They came for usually periods of a week each. Most of the doctors were white. A few of them came down were black.
MCHR volunteers would stay with local black families or in motel rooms. Although they were not officially licensed, they could legally administer emergency medical care. MCHR staffed 5 medical centers with volunteers.
The Medical Committee for Human Rights really became the medical arm of the civil rights movement, whose mandates, number one, was to take care of civil rights workers and local community people who could not receive appropriate medical care, to challenge segregated waiting rooms and doctor offices, to try to provide support to local cooperative physicians, be they black or white.
MCHR staff were stunned by the conditions of medical care in Mississippi.
Segregated care looked horrible. It was so obvious and blatant. The rooms for black patients were dilapidated. The beds were old. The equipment was old. You immediately felt you traded your dignity for care.
Hospitals in the South often denied medical care outright or forced black residents to pay up front.
We had no way to transport people on the march. The local government would not supply us with ambulances to transport people to the hospital. The black funeral directors supplied us with a hearse as an ambulance.
MCHR soon worked to end segregated healthcare in the South.
To show those inequities, that you would not have access to care based upon your income or your skin color. Medicare is one of the most important civil rights wins in America. It has been around since 1965 in New York City. We were given this opportunity to have Medicare by Mayor Lindsay, and he had to pass a law to give it to retirees in 1968. January 1, it became effective. This was powerful, and this is why it is important that the New York City Council remember its roots, remember the understanding that was given to the American people. You pay that Medicare tax, and we will provide you with this beautiful health benefit of public health care. The city provides the city supplement as promised by the Lindsay administration to New York City retirees. That provided equitable health care to every New York City worker because that was what was right. There was no mention of privatizing Medicare. There was no mention of putting retirees into inferior healthcare plans that were narrowed by networks, preventing them direct access to medical treatment and the doctors of their choice. That those who were wealthier could pay to go see the doctor that they want because they're out of network, but those who can't won't. That is, again, creating the inequity that we fought almost 60 years ago. This last screen that I would like to share is an article by Reuters to show that we are moving backwards. This article was written in 2017, African Americans who buy Medicare Advantage fare worse. And there's several articles and studies like this. Medicare Advantage plans may be creating a disadvantage for Black patients who need major surgery, a new study suggests. In New York State, where the study was done, Black seniors on traditional Medicare were 33% more likely than whites to be readmitted to the hospital within a month of surgery, researchers found. Moreover, the disparity nearly doubled for Black seniors covered by the more expensive and supposedly superior Medicare Advantage plans. Blacks covered under private Medicare Advantage plans were 64% more likely than whites to be readmitted to the hospital within a month of surgery, according to the report in Health Affairs. Medicare beneficiaries pay additional premiums from Medicare Advantage programs, commercial insurance plans, touted as offering comprehensive disease management and care coordination to help seniors manage health conditions. Medicare Advantage has not been successful in reducing the readmission rate for Black beneficiaries, read author Yu Lee, a health policy professor at the University of Rochester Medical Center in New York. She said in an phone interview, "What are the mechanisms? I don't know for sure. The study analyzed data from 13,703 patients with traditional Medicare and 6,632 with Medicare Advantage plans who underwent one of 6 types of major surgeries in New York in 2013. All were 65 and older. The average age was 66. Overall, 30-day readmission rates were almost identical for traditional Medicare and Medicare Advantage patients, 13.2% among Medicare patients and 13.1% among Medicare Advantage patients. For whites, Medicare Advantage reduced the likelihood of a 30-day hospital readmission rate by more than 12% over traditional Medicare. For Blacks, however, Medicare Advantage increased the odds of readmission by nearly 11% over traditional Medicare. Dr. Joseph Betancourt, who directs the Disparities Solution Center at Massachusetts General Hospital in Boston and was not involved with this study, expected to see racial disparities in hospital readmissions. But in fact, the disparities were nearly twice as large for Medicare Advantage patients compared to traditional Medicare, surprised him. That gap's pretty big, he said in an interview. There's something significant going on here now to figure out why it is worse, counterintuitively, if you have Medicare Advantage. Since Medicare was established in the United States more than 50 years ago, disparities in health outcomes have persisted between Blacks and whites, prior studies have shown. But the new report is the first to examine the impact of Medicare Advantage on the disparities, Lee said. Medicare Advantage data is not generally available to researchers, but New York State granted access to Lee and his colleagues. The great unknown is, why do we see greater disparities in Medicare Advantage than in traditional Medicare, Betancourt said. The government is expecting if you get people into Medicare Advantage, the readmission rate would be lower. But as we move people towards Medicare Advantage, African Americans have worse outcomes, he said. In spite of financial incentives for Medicare Advantage plans to prevent unnecessary hospital admissions, previous research shows mixed results when comparing the two programs' readmission rates. We can't do a one-size-fits-all, he said. After sharing all of those pieces with you, it's very important for you to understand that Martin Luther King was a hero in the civil rights movement. He genuinely cared about people. He cared about housing. He cared about access to food. He cared about healthcare. He cared about them as human beings. Pushing people into Medicare Advantage in New York City to have Mayor Adams and Speaker Adams and Carmen de la Rosa clear a path, potentially, to force retired workers, mostly women and people of color, into inferior Medicare Advantage over a public federal health benefit of Medicare is criminal and walk back everything that Martin Luther King fought and died for. On his birthday, January 15th, it is important that we recognize what he stood for, what he fought for, and the whole fight for equality in healthcare, equity, and so that every American had access to health care to any provider that they wanted to see, regardless of their income or their skin color, needs to be upheld, especially in the city of New York. And this is our fight. And New York City Retirees is going to continue that fight into 2024. We have been in court with this mayor for almost 2.5 years. It is important to protect the federal public health benefit of Medicare and the promise that the city of New York made to New York City workers and retirees that they would have Medicare and a city supplement paid for by the city of New York after all of their years of working and giving up higher wages and not working for the private sector when they could have. We dedicated our lives to service. The city made a promise. You do this, we will give you Medicare and a city supplement. Now, as retired union labor, this mayor seeks to take that back. And in the name of Martin Luther King, of all the forms of inequality, injustice in health is the most shocking and inhuman because it often results in physical death. Mayor Adams, Speaker Adams, Councilwoman Carmen Della Rosa, the New York City retirees are asking you, where do you stand on protecting traditional Medicare and New York City retirees? Happy birthday, Martin Luther King. The New York City retirees honor your commitment to civil rights, equity, public health, housing, and stand against discrimination. Have a good day.